older adults have in common. Experiences of ageism, which is harmful for health. Dr. Allen.
Short over here, so I want to make sure you can hear me, and I do teach undergraduates every day, so I will try to be loud, but feel free to like wave at me or wink at me if I'm not loud enough. So good morning. So thank you for joining us, and I'm so thrilled to be after the stretch break. I think I have the best spot in the program. But I am just going to share a little bit about some of my work and that of some of my colleagues. Give me just a second. There we are. All right, so today I'm going to be talking a little bit about ageism, just some sort of introduction to make sure that we're sort of all on the same page in what we're talking about today. I will share some recent research findings on sort of the prevalence of ageism, how common it is in the older adult population, as well as some linkages between ageism and health. And then I'll finish up by talking about some strategies that we can use, both us in this room, but also us as a country, as a nation, as a society, to address ageism, as well as some other strategies for promoting healthy aging. So before we even get started, I just want everyone to take a moment to think, sort of in your own head, when do people become old? I hear some wonderful answers. So I have a 19-year-old son, and he is a sophomore at the University of Michigan. Go Blue. I see some in the audience. So when I ask my 19-year-old son and his friends, when do people become old? They're like, oh my God, Mom, you're old. Our parents are old. So 19-year-olds will often identify people in their 40s and 50s as old. But when I ask people in their 40s and 50s, when do people become old, they more often than not pick something around sort of the ballpark of 65. But when I ask 65-year-olds when people become old, they're more likely to say something like 75. And of course, you know the answer. When I ask 75-year-olds, when do people become old? They're like, oh, maybe 85, maybe 90. So I think it's really important to acknowledge that there's a real lack of agreement on when people become old, sort of what is the definition of old. Now, our federal government, more often than not, uses sort of 65 years old and up. That's the age at which people are eligible for Medicare. That used to be the age at which people were eligible for full Social Security benefits before they pushed it up to 67. The average age of retirement in the United States is 64, of course, for those who can afford to and want to retire. Now, some people, when I ask them, when do people become old, they say, well, it's sort of when you feel old. They don't use a chronological age. It's sort of more this sort of self-defined concept, when people feel old, so it's more related to activity or attitude or sort of lifestyle. Now, in my own research, and sometimes people get mad at me for this, in my own research, I actually study adults ages 50 and up. There's a couple of reasons that I do that. Typically, we start seeing cases where people experience discrimination due to old age, typically starting in their 50s. So most of the cases where people feel that they've been discriminated against, typically in the workforce, those more often than not, they sort of start amongst people when they're in their 50s. We also find that people start thinking about old age on a more frequent basis, again, when they're in their 50s. People start sort of planning ahead or sort of thinking about it. And then sort of lastly, we find that many chronic health conditions that we typically associate with olding, they're sort of like old age conditions, ones that are common in the older adult US population, a lot of those are diagnosed when people are in their 50s. Although we do find that it's sometimes younger in disadvantaged populations, so amongst African Americans, American Indians, and low-income populations, we actually see some of those diseases being diagnosed when people are a bit earlier in their 40s. Now you can look at your neighbors and wonder, how did they define when someone becomes old? And is it different from what you said? It might be. right, so while many different things influence the health of older adults, one important factor that often gets overlooked is our societal attitudes and behaviors about aging and old age and older adults. So I'm talking about ageism. Ageism refers to stereotypes, prejudice, and discrimination related to old age, aging processes, and older adults. Now, people of any age can be discriminated against because of their age, but today I'm really focusing on older adults because they are systematically disempowered, devalued, and excluded from many aspects of contemporary society. Now, ageism is deeply embedded in our culture in this country. I have some colleagues who do research with preschool-age children, so we're talking about, 2 and 3-year-olds. And they find that these really small children not only identify older adults as like a separate category of people, they actually exhibit ageist beliefs and behaviors. So we are teaching our sort of stereotypes about aging, a lot of which are negative, as I think we all know, to 2 and 3-year-olds. So ageism can be intentional, but sometimes it's not. Ageism can be overt, really sort of obvious and easy to sort of identify, but oftentimes it's actually very subtle. Some examples of ageism are thought to be funny. I think we all can think of some of those. Some examples of ageism are thought to be considerate, and others are actually thought to be complimentary. But when we sort of assume that all older adults are the same, and that there's this sort of lack of diversity and individuality, it actually strips older adults of their sort of independent identities, and it's used to justify treating them with less respect and offering them fewer rights within our society. So ageism is generally thought to be the most common, the most socially acceptable, and the most institutionalized form of discrimination in the world, and certainly in the United States. Not to say it's necessarily the most harmful. We're still working on sort of comparisons, but the most common, the most socially accepted, and the most institutionalized. And there's actually a substantial amount of research looking at other types of discrimination and the ways in which they are harmful. There's a lot of research on racism and sexism and homophobia, and yet the research on ageism, there's a lot less. And in fact, people haven't really been studying the negative implications of ageism. We've only been doing it for about 10 years, believe it or not. There's one researcher at Yale who's done more. But it's really only become a topic that people have paid attention to in the last decade. And that's really been a lot of the motivation for the research that I've been doing the last couple years, because in order to establish that ageism is a problem, and it's something that we need to do something about, we really need some sort of strong evidence on how many people are affected, what groups of people might be affected more than others, and what are the harms. How can it be harmful to individuals, to health, and to our, to greater society? So there is a growing body of research that ageism is bad for health. We found that people who report that they experience more ageism are less likely to engage in health-promoting behaviors. They're more likely to engage in risky behaviors like smoking or having a couple extra glasses of wine or not being physically active or ignoring their doctor's recommendations. Individuals who report that they experience more ageism tend to have poorer cognitive and mental health outcomes and greater declines in those areas over time. They tend to have more functional limitations, more chronic pain, more chronic diseases. They tend to have more hospitalizations in an average year and longer ones, and more costly ones. They also tend to recover more slowly, whether it's from surgery or an accident. We found that individuals that report that they experience more ageism actually have a lower will to live, and on average die 7.5 years earlier I know, I see some wows in the audience. People who report that they experience more ageism die on average 7.5 years earlier than similarly aged people who report that they don't experience as much. So the health consequences of ageism are huge. So one particular form of ageism that I am interested in is sort of that routine ageism that older adults experience on a regular basis, just sort of in their day-to-day lives. I refer to this as everyday ageism. So it's that sort of routinely encountered, sometimes it's verbal, sometimes it's nonverbal, sometimes it's sort of within your greater environment, but they're indignities that convey hostility, a lack of value, or stereotypes of aging and older adults. So take a moment to think about, how often do you see birthday cards with jokes about aging? When was the last time you opened a magazine and you were bombarded with anti-aging, anti-wrinkle, anti-gray products and procedures that suggested that aging isn't beautiful, or that you should avoid it at all costs? Or if you can't do that, at least you should hide it. When was the last time you observed an older adult be told, "Oh, you look so great for your age"? Or, "It's great that you have so much energy"? Or perhaps you've observed people assume that older adults have hearing problems and they talk really loud. Or assume that they have memory or cognitive issues. Or assume that they can't use the newest app on their phone or other technology. Or the one that I think might be the worst, when people assume that older adults, their schedules are wide open because they don't actually do anything important every day. And sometimes older adults believe some of these stereotypes themselves. They believe that poor health is inevitable in old age, or that they're going to be lonely or depressed, and that these things are just part of aging. And when you think about it, well, these are examples of what I consider to be everyday ageism. These sort of seemingly small, seemingly minor, but reminders that sort of aging is negative and bad and should be avoided. And if you think about it, many older adults experience these types of things multiple times a day, most days of the week. They experience it in their interactions with their friends, with their families, with their service providers, and sometimes these ideas are even in their own heads. And unfortunately, compared to other forms of discrimination, ageism is particularly likely to be ignored or dismissed. "Oh, it's no big deal. Oh, it's just a joke." Which makes it a little bit more difficult to sort of snap back and say, "Hey, no, that's problematic." So a couple years ago in 2019, some of my colleagues and I decided that we need to get a better handle on experiences of ageism in the United States. We were particularly focused on these sort of routine, everyday examples of ageism. So we actually surveyed people. We did a large sample with a nationally representative sample of US adults ages 50 to 80. And when I say nationally representative, these people were chosen to sort of approximate the characteristics of older adults across the country. And this is what we found. Over 93% of American adults ages 50 to 80 reported that they experienced one or more forms of everyday ageism in their day-to-day lives. That's a really big number. And when I say that, I'm not saying they experienced ageism like once ever. These people reported that they were experiencing one or more of these different types of things on a regular basis, frequently. We also broke it down by age. And as you could see on your right, as we sort of expected, we did find higher reports of everyday ageism amongst people on the older end of the spectrum, ages 65 to 80. But we also found very high levels of ageism reported by those between the ages of 50 and 64. So all those people sort of push back on the fact that I start doing research on ageism amongst 50-year-olds. Well, this is why I do it, because they are experiencing it. And we do believe it is harmful for health even amongst those in that sort of 50 to early 60s group. We also ask people about 10 sort of different things, common examples of ageism that we see in sort of the contemporary US. Now, I'll just note, we don't actually ask people if they experience ageism, because lots of people say no. No, they say they haven't experienced ageism, but when we start like going through examples, they say, oh yes, I have gotten the birthday cards. Oh yes, someone has talked to me like I have hearing problems. So what we find is that a lot of people don't really know what ageism looks like. But when we give them examples, they do. And we sort of asked questions that fell into sort of 3 different groups. So we asked about exposure to ageist messages that sort of reinforced some of those stereotypes and negative attitudes about aging. So again, this is the birthday cards, this is the magazines, this is those sort of messages in either the social and physical environment indicating that sort of aging is undesirable. 65% of US adults reported that they experience these types of things regularly. We also asked about ageism in interpersonal interactions. So this is when older adults report that they have been treated differently because other people made assumptions about them just based on their age. So this is active experiences of discrimination. And 64% of US adults between the ages of 50 and 80 reported they experience these, again, regularly. And then finally, internalized ageism. So that's when older adults agree with some of the negative stereotypes linking older age and poor health. They say that poor health is part of aging, loneliness is part of aging, depression is part of aging. And a whopping 81% of adults agreed with some of these statements, indicating that some of those negative ideas about aging that they developed when they were in preschool, they stuck with them, and they still believe them. So this is some data from that same study. So the last slide, I was giving you numbers based on who reported, at least one type of everyday ageism. But we also sort of make a scale to indicate sort of how many different kinds and how frequently. And this is the average score in the nationally representative sample. Lower numbers are better. Higher numbers mean that they experience more different types of ageism on a more regular basis. So the average in that nationally representative sample is 10.2. Since then, I've been doing some additional studies, really diving into racial and ethnic differences in ageism. So I did another study a little bit more recently, and we found the average at a 12.2. Now, these are 2 very different studies. The people who participate are very, very different, but what we actually think, those numbers are very different. That 2 points, that's a pretty significant increase in ageism. And what we think happened was COVID. That 2019 study, we did that in November, right before COVID hit in sort of February or March of 2020. And then the other study, we were collecting data sort of at the tail end of when COVID was starting to dissipate. And some of the different activities within greater society were sort of loosening up. And other studies have really been found similar things. Reports of ageism seem to have gone up substantially just in this brief time frame, really the last 6 years. And we know that COVID was one of those instances. We saw a lot of ageism in social media, in mainstream media. Ageism was influencing policy making regarding what types of safety measures different communities were gonna take. And it was influencing healthcare. Who got treatment and what types of treatments were prioritized. So we do think there was a substantial increase in ageism just in this very brief time frame. And as far as we know, it hasn't dissipated. Those levels have remained elevated. that is a great lead-in. We're going to get to that in a couple minutes. That is actually very relevant to where we're going, so thank you for bringing that up. So I also have done a couple studies to sort of identify who experiences more ageism. Because if ageism is harmful, then it's really important to understand what groups of people or what characteristics of people put them at increased risk. And this is what we found. Certainly those on the older end of the sort of age range do report more compared to their slightly younger counterparts. We've already seen that. We found that individuals who report that they look relatively older, when they compare themselves to other people their age, they report that they look older. They also report more ageism, as do individuals with less education and less income, those living in rural areas, and those who spend more time with media, so whether it's magazines, television, the internet, all report that they experience more ageism than their counterparts. We've actually had some mixed findings on whether there are racial and ethnic differences, and we have not found differences by sex. So these were some sort of unexpected findings, and I'm happy to address them in the Q&A. In terms of sort of identifying those groups who may be at increased risk and developing interventions to address ageism, targeting some of those at-risk groups is a really important strategy for thinking about promoting healthy aging. So with our sort of everyday ageism research, we just wanted to confirm, frankly, what some of the other studies have also found, that ageism is bad for health, and we did confirm that. People who report more exposure to sort of that routine ageism also tend to have worse mental and physical health outcomes. We also asked people sort of what happened right after they experienced ageism, and a lot of people reported that they had those sort of fight or flight responses. Their heart started beating a little faster, they got a little anxious and uncomfortable, maybe they got distracted, maybe they went home and had an extra glass of wine, or maybe they avoided people and places where they had negative experiences. And also a lot of people reported that they became more self-conscious. When other people brought up aging, and particularly negative aspects of aging, they just sort of started thinking about it and feeling sort of uncomfortable. And we know that when people are self-conscious about their characteristics, it interferes with cognition, it affects mood, we know it affects behavior, and if that happens on a regular basis, it can have negative implications for health. So going back to our earlier question, how does ageism affect health? I mean, ageism is this broad sort of social and structural phenomena, but how does it actually affect our bodies? How does it get under the skin? Well, one is as a source of chronic stress. If people are exposed to these uncomfortable situations on a regular basis where people make assumptions about them, especially when they're not true, that can generate those fight or flight responses, that can generate coping behaviors that may or may not be good for health. And over time, if this happens on a regular basis, it can actually start to wear down some of those biological systems involved in the fight or flight response, in the stress response. And that can lead to accelerated aging. It increases risk for multiple different chronic diseases, and it's associated with premature mortality. We also know that ageism can serve as a self-fulfilling prophecy. People have studied sort of midlife folks, people in their 30s and 40s, and if they have really negative attitudes about what life is going to be like when they're older, guess what? They have really negative experiences once they do become older. We know that when sort of midlife folks have really negative attitudes and they assume they're going to be in poor health, they assume they're going to be lonely or depressed or unhappy. They're less likely to engage in health-promoting behaviors. They're more likely to sort of ignore some recommendations. They don't go to the doctor because they just assume, well, I'm in pain. Pain is part of aging. When we have very effective treatments for pain. We found that older adults who, when they do seek health care, they feel that they're patronized, ignored, not listened to, or treated disrespectfully. they are less likely to go back. When people have negative experiences at the doctor, they don't want to return, and so they may, push off needed health care. Unfortunately, we have also found that older adults receive poor quality health care across the board when compared to their younger counterparts. Ageism is embedded within our healthcare system, and that can range from the beliefs of healthcare providers who tend to either ignore health problems amongst older adults or kind of go overboard and they overtreat. They tend to actually not follow best practices, and the vast majority of recommendations for people over the age of 60 are based on their chronological age. What medications they get, what treatments are recommended, what other interventions are recommended. Those recommendations are based on chronological age and not on individuals' health and whether a particular individual may actually do very, very well. We also find that there's substantial age discrimination in employment, housing, and other areas of life, and those have ripple effects for health. They affect people's finances, their social relationships, their sense of purpose, and all of those are important factors that influence our health. And then finally, ageism can exacerbate other disadvantages that people may already be experiencing. So switching gears just a little bit, while societal attitudes and practices linked to old age and aging are largely negative and unfortunately growing more negative with time, many of the older adults that we talk to identify many important benefits and privileges of being older. We already had some suggestions from the audience. But things like greater social acceptance of pursuing one's hobbies and interests instead of focusing on some of the tasks of midlife like making money and taking care of family. Older adults report that they're eligible for age-specific discounts, privileges in housing, tax benefits, COVID shot access, and federal programs like Social Security and Medicare. So we asked older adults about this in several different studies, and we have found that older adults report positive experiences of aging of many different kinds. So in the national study on your left, we found that 88% of older adults report that they're actually more comfortable being themselves than they were when they were younger. They have a strong sense of purpose. On your right, that's that second multiracial, multi-ethnic study. Many older adults report that they feel that they are treated with respect, that their opinions matter, and that they really value being a good example for younger individuals. And as you might expect, people who report more positive experiences of aging, they have better mental and physical health outcomes. They also report fewer experiences with everyday ageism. So we think that these positive experiences of aging can really buffer people from some of those negative societal attitudes and practices. So what do we do? Increasing awareness about ageism and its harms is a necessary prerequisite. People need to know what ageism is, what are examples of ageism, and that it is actually bad for health. And this is just a side note. This is why my colleagues and I that do work in this area have done a lot of, invested a lot of energy in really trying to hit the national sort of mainstream news outlets, because we have to raise awareness of ageism if we're going to be able to do anything about it. Ageism has also come up a lot. It was a major topic in sort of national political debates. It actually was talked about in a recent Saturday Night Live skit. Recently, well, not that recently now, but CBS Sunday Morning, some of you may have seen this, did a really great feature on ageism a couple years ago, because we're really trying to raise awareness of this phenomena and the fact that it's integrated into our culture, but we have to do something about it. So, many of us in this room probably have been raised in this country, and we have been raised with ageist ideas from a very early age. But the more we're aware of them, we don't have to act on them. So the more we start to sort of monitor ourselves, monitor other people in our lives, monitor the organizations we're parts of, we can stop ageism from influencing behaviors, practices, and policies. Breaking down stereotypes. This needs to happen at the sort of societal level, in healthcare, and certainly in our own heads. There's a lot of different strategies that have been used to do this, but one of the more effective ones has been really promoting intergenerational contact. Because we know that when people across ages have relationships, they find that those stereotypes, they just don't make sense anymore. And they start to dispense with them. There are some wonderful reframing aging initiatives, and I mentioned a couple of them at the bottom of this slide. If you're interested, there's some national ones as well as international ones that are really looking to change narratives about aging, to emphasize diversity within the older adult population, to emphasize individuality, to promote some of those positive experiences of aging that older adults talk about. And this is one where, this needs to happen at the societal level, but this is where you guys can step into. So the next time you're thinking about making a comment about a senior moment, or you're thinking about complaining about the gray hairs, or maybe you observe an older adult with technology and you're going to make a joke about how older adults can't use technology. Maybe I'm asking you to think twice. Because maybe gray hair is beautiful, and that's a sign that someone has been privileged to live long enough to grow it. Maybe someone is having trouble with technology, but guess what? I have trouble with technology. My 19-year-old son calls me for technological help. Lots of people have trouble with technology. That is not part of aging. And the more we sort of keep those comments to ourselves and remind ourselves that, you know what, that's just a stereotype that I have been raised with, but I don't need to say something about it. I don't need to reinforce it. It's a step. And that's what we're doing. We're making steps. And last, a lot of my research has shown that really promoting those positive experiences of aging may be a very promising strategy for actually improving health of older adults across the country. So in summary, ageism is common, and it is experienced by pretty much all groups of older adults that we've studied so far. Those seemingly minor comments and assumptions about aging may actually be more harmful than we realize. While all groups experience ageism, there may be some who are at increased risk for both experiencing it and some of the negative ramifications. Positive experiences may protect us a little bit from some of the negative attitudes about aging and some of the negative behaviors and policies. And this is the next one. This is the most important point that I am making today, so I hope that everybody will focus in on this. Many of the health problems attributed to chronological aging and unalterable biological processes, things we think of as health problems of old age. They may be caused or at least exacerbated by our societal attitudes and behaviors related to aging. Things we think of as inevitable and just part of aging are caused or exacerbated by some of our societal attitudes and beliefs, which means if we can change them, we may be able to prevent some of those health issues, or at least move them back. If I develop health problems when I'm 90, I can work with that. That sounds pretty good to me. I'll take it. So the more we address ageism in our society, the more we're all going to live longer, healthier lives. So that is it for me. This is just a little bit of information about my lab. You will have access to these slides, so you will be able to see this on your own. But also just thanks to some of my supporters, some of my funding sources, and that is it for me. Thank you very much.